Thanks for coming. We'll start with introductions briefly. I'm Devon Brackill. I'm at the Annenberg School for Communication.
I'm Jingwen. I'm also from the Annenberg School for Communication.
I'm Molly Porth. I'm from the Fels Institute.
And I'm Kobylarz. I'm also from the Fels Institute.
And we are Team FitPhilly. What FitPhilly proposes is a mobile smartphone application that has a map built into it that provides information about healthy options in the neighborhood. It will be a free app and will operate through the nonprofit model. Our goal is to, as the tagline says, make it easy to make healthy choices. When I did a Google search for farmers markets close to my house, this is actually just sort of southwest of here, I want to direct your attention to the results that came up. The box on the left, the closest farmers market was in Edison, New Jersey, which is about an hour and 15 minutes north on I-95. And in particular, I want to direct your attention to the box on the right. That is Clark Park. I live close to there. And so from my previous experience, I know that this is unfortunately there. Unfortunate for the search results, fortunate for us. The problem that we identified and that we're trying to look at is that information about healthy options is kind of being missed by our search tools. The concern is that local data is actually available. We'll talk about that in just a minute. But that our current search tools, Google Maps of all things, is failing us in some way. And what we want to do is to address the kind of larger problem of obesity in the city. If I can back up and talk about this just for a minute, this is a map. This is drawing on data. The map itself is from data from 2008. Statistics on the side are from 2010, the most recent. The map shows in red, we see the highest rates of obesity, that's 70% and above. The orange shows the second tier, and the yellow shows so on and so forth. These are rates of both overweight and obesity. Those are the two highest tiers. Across the entire city, about 2/3 of people fall into the highest tier. A third of people in the city are obese. That's the highest tier. And we also have low rates of things like exercise in the city. About 2/5 of adults exercise fewer than 3 times per week. And Philly has some of the highest rates, actually the highest rates of obesity, hypertension, and heart disease of the 10 largest cities in the country. And we're second highest in terms of diabetes. The solution we try to propose, we recognize that obesity is a complex phenomenon. It's caused by lots of things. The solution that we propose is a smartphone app that tries to provide information at the point of decision making for people. It makes the data available in the most easily accessible format. Why does information matter? And exercise, these are habits that happen cumulative over a period of time. And the best predictor of what you're going to do today in terms of exercising, in terms of eating, is what you did yesterday. And so what we want to do is when you're at the moment of decision, when you're deciding, am I going to go to the place that I went yesterday, the place that I went last week, we want to insert here the FitPhilly smartphone app, which will provide the information and will provide a way in which you can think about options outside of your daily routine, and you can start some of those new behaviors. How does FitPhilly actually change behavior? We try to target information. So the app itself provides information about healthy grocery stores that may be nearby, healthy prepared foods, places to go out to eat, economical gym memberships, rec centers, sports facilities, parks, these kinds of options that you may not be aware of that are close by either where you work or where you live. Then we target, that increases awareness. So people are now aware of options besides just the things that they do every day. That increases their healthy choices, increases their awareness of what other people are doing, their awareness of social norms. And then in turn, this also acts as a cue to action. What we mean by this is that it provides how-to information about exactly where to go to start a behavior. The next concrete steps you can take if you want to try and eat healthily outside. And then it results in behavior change itself, so increased healthy food intake and increased exercise rates. So the app itself, when the user downloads the app, it will show 4 options. These are kind of categories of things you can look to investigate. So we have things like sports and recreation, restaurants, fitness locations, and grocery stores, places to eat. Once you click on this, a map comes up with your current location and the healthy options that are available around you. Clicking on those options pulls up another menu that provides more detailed information, such as hours, the things that are actually sold there, the exact street address, phone number, that sort of thing, web address as well. Our plan involves partnerships with a number of different organizations. On the one hand, both data, and on the other hand, both the kind of rolling out of the app. In terms of data, we're interested in leveraging information from both the Food Trust and the Department of Public Health. Both organizations have information about things like healthy corner stores, the Healthy Farmers Market Initiative in the city, information about neighborhoods that may need to be targeted, information about exercise facilities in the city through both of those organizations. And we've met with both of those organizations, are in ongoing conversation about how best to kind of use the data that they have. In terms of rolling out the app, we've met and talked with the Key Spots initiative. This is an initiative in the city that provides facilities for computer facilities in locations throughout the city. And this is one way in which you can educate some of the public about these, a new kind of software app, so we could roll it out potentially and advertise it through these locations and target some of the areas in the city that we're interested in targeting. Finally, it fits, our program fits well within the initiatives of the city itself and the mayor's office. Obesity has been important in the city. They've worked on many of these kinds of initiatives. Development of the app will involve a free event called a hackathon, which is basically where a group of creative individuals, developers, project designers, coders, come together and over a course of a weekend or a week and kind of develop the app itself. Our costs are broken down both into the development, which we estimate to be about $8,000. That's for the development of the database and the creation of the GPS system, and then also for the maintenance costs. In terms of timeline, I won't sort of stress this in too much detail, but what we're looking for is the first 3 steps are kind of ongoing over the course of several months. So we'll both be trying to secure funding, but also be working on developing the app and building and securing the database. Our first stage involves a kind of pilot launch and then in a neighborhood, and then we'll want to evaluate that pilot launch before launching it to the entire city. In terms of metrics for success, we're interested in how the number of users who actually uptake and use it, but also the frequency of use. We don't want people just to use it a single time. Do they come back to it? The app also allows for the uploading of user-generated data, so if there's information about local stuff, you can add that as well. So are the users participating in the app? Expansion of the database, can we secure more information? And is it recommended by physicians? That's one way. Another way we've been talking about rolling out the app is targeting it through physicians. So once we would roll out the app, this is the kind of fundamental problem that we would solve. The app would display, when you try to search for, in West Philly, farmers markets, you'd get Clark Park's farmers market would come up. Clicking on that, you would get information about the farmers market itself, its hours of operation, and the vendors that are available there. Thanks, and we welcome your questions.
Thank you. I have two questions. The first is, in many low-income communities, people have cell phones, but they don't have smartphones. Have you thought about creating an SMS tool for this technology as well? Not just making it an app, but also SMS available. The second question is around hackathons. People oftentimes start a live grade tool. In our experience, what we found, having many of the folks who create tools and hackathons then come to my office to get them further funded and to move the applications along. I think the budget might be a little low based on having funded a number of mobile app locations all over the country. And you have to have a champion that's willing to move it forward beyond hackathon so that it gets fully developed. So who might that champion be for this app? And then finally, have you thought about how the app gets marketed?
Thank you. That's a great question. So in terms of the first question, we tossed around several ideas in terms of the challenge of working with low-income populations that may not have access to smartphones. So we tossed around the idea of having an SMS built into it, but I think what we decided to do after talking with several stakeholders and community-based organizations is to take the route of having a website to go along with it. One of our main partners is KeySpots, which is the public computing centers, free computing centers in community-based locations like rec centers, et cetera. So I think the route we decided to go is to develop the website, to work with KeySpots to have the website accessible at these spots throughout the city, and also to have a printable component of the app so you can take a freeze frame either from the app or from the website and to be able to print that out. So if you're, for example, a farmer's market, a food trust employee working at a farmer's market or giving health classes, you can use your phone, use that to print out some physical maps and distribute them to your clients. So those are the two routes that we decided to take in terms of low-income populations and not having access to the smartphone. I can also speak to marketing, the third question. So we can go back to our timeline. So after the development, the hackathon, we will start by launching a pilot program in a targeted community in Philadelphia. So whether it be West Oak Lane, West Philly, we'll target one specific neighborhood and work with them and develop the pilot for several months, take a period for evaluation, and then we'll launch into the full campaign and the media campaign. And for the media campaign, we'll work with, similarly, our partners, including KeySpots, the Food Trust, and the departments in the city, the health departments. We'll distribute our brochures and materials through those partners, and we'll also do, of course, a social media campaign. And then, end up with the full launch, and that will overlap with the media campaign in the summer. spring, summer of 2014.
And I can speak to the funding a little bit too. Through our meetings with different partners, we've actually have two different routes that we're going to explore for additional funding, because you're totally right, $8,000 is not enough to make the app and continue to maintain it over this long period of time. So, we originally were like, we're going to look for foundation funding, someplace like the Cleneal Foundation, which supports like healthy initiatives locally, and then larger, something like Robert Wood Johnson, which is looking at big national healthy initiatives. So foundation funding is one thing we're going to pursue, and then additionally, it was a suggestion for us to also look at venture capitalists for something like this. Where we were talking about public funding, and somebody was like, why don't you look at private funding? Because there are plenty of venture capitalists out there that would probably like to invest in something like this, and then potentially use it as a model for other cities as well. So those are our two ideas, and that's how we're going to pursue additional funding. Other questions?
I wanted to ask you, do you have other similar apps that you look to from their experience? Developing thoughts on this? One question.
Okay. I can talk about the other apps available for healthy changes. So currently we have like hundreds of health apps on the Apple Store. So here you can see the three screenshots of different apps, but most of the apps are focusing on calorie and exercise tracking. So when a user is using the app, the user needs to input every information. So we think it's very difficult to use, and if you're not like really determined to change your behavior, you're not going to like enter every calorie you're taking for every day. So those really requires a lot of user input on a daily basis. There are not many apps available for example, of an interactive map that can direct you to different locations. So the app we proposes here is very innovative. I only know one app which is called Spontaneous, provides this interactive map, but it's only implemented in New York, and I think only in New York thus far. They haven't expanded to other cities, and they're having their own issues as well, because they don't have the public health information from different stakeholders, and they're not specifically focusing in one city. So that's our knowledge of the available apps.
The other thing I was thinking, and it really follows up on what the other judges mentioned, which is the hurdle of not everybody has a smartphone. Right. And so how do you get this word out there? It seems to me that you could somehow use partner with schools and the school system in order to get this information out there accessible to young people so that they could take it home and to their parents. I'm wondering, is there any way to partner perhaps with SEPTA, because I think it helps a lot of people riding the trains that would be able to want to access this information as they make their commutes, and it may be their population, parts of their population trying to attract. So I just worry about that gap between those who would have access to the smartphones and who would get this information.
I can add some more statistics about smartphone owners and who use health apps on their smartphones. So currently in the US, 45% of the adults have smartphones. We don't have local data in Philadelphia, but that's the national statistic. And among almost 20% of the smartphone users use at least one health app in their mobile phones. And we think this trend is increasing in the following years. So currently we have this number, but definitely next year we'll have more of the smartphone users. And the demographic distribution is that Black people and minority people actually have higher ownership of smartphones than whites from the pure internet surveys. Also, just to follow up on the school question, we have been following this trend in schools, and there are currently several initiatives targeted towards lowering childhood obesity in the city. And recently, data was released that it decreased by about 3 percentage points, and that was mainly through targeted school initiatives in the lunchroom, in the fitness programs, after-school programs. So we have been following that trend, and our target really for this app is the adult population and the parent population. So we think of it kind of as a very nice complement to the current programs going on in schools. So the kids are learning, you know, in their after-school programs or in the lunchroom about anti-obesity and healthy living, healthy habits, and this is kind of a complement for the parents and the caretakers.
As a parent, just remember kids drive parents' choices very often. You want to influence those kids too.
Absolutely. Absolutely.
Have you had conversations with potential users about the specific types of information that they're lacking or what they're lacking information that you all provide?
I mean, well, I feel like everyone in this room is a potential user of something like this. So for us, it's been very easy to sort of be like, well, I would use this, I would want to use that. And I think most of the feedback that we've gotten from all the meetings that we've been having has been sort of our way of kind of identifying which types of information people want to use and want to see. And I think, you know, with the pilot program, that's one way where we'll be able to really test out that with this very specific targeted population.
I think one thing to consider is really making sure that when we are having these conversations that the people in this room are probably not generally reflective of a lot of the people who are lacking information and, you know, are the population that you would want to target in order to combat obesity. So starting to think about what incentives might really motivate people to change behavior. And thinking about how you build that into an app so that it's not just a, you know, once I want to go and see, oh, there's a farmer's market over there and I have like a couple hundred apps on my phone. But I think you need to figure out what differentiates this and makes it something that people come back to on a regular basis in order to really create that behavioral change.
Do you want to talk about social networking? Yeah.
We have some add-on ideas for this app because this app is a platform for developing more innovative ideas. For example, one idea is to create a social network within this app focusing on healthy behaviors and choices. So you can form relationships with your friends, colleagues, and families. So you can change information about your exercise choices. And that's one social component. The other one is we collaborate with local business so they can promote their deals and, for example, offers to people. So if they want to find like cheaper deals, economic gym membership, they can check into the app and redeem that offer from our app. So this is a collaboration with the app and also the local business, offering low price choices for low-income population. And the third one is based on our research at Annenberg, which is a recommendation system. So for example, you may not aware of a lot of different behavior change choices, but we can recommend to you some based on your behavior choices and also your choices from your families and relatives. So you can think of this way. So you have been using this phone for about a month, and we have data on your previous choices and behaviors. Then we can recommend a specific effective behavior change strategies for you in the future you are not familiar before. And we're trying to develop this kind of recommendation system in our school, and we think this will be a very potential add-on for this app in the future.
Who's the audience?
The audience? The target audience.
Yeah,
do you want to talk?
Go ahead.
We have a slide for that, I think. Can you find it for me? Yeah. So we're targeting adults, but the main focus of this is we're targeting people who want to change. So these people are already motivated, they just don't have the information to help them make those decisions. As Jingwen said, research shows that a lot of people have smartphones now. This is the way they're accessing information. Particularly in low-income neighborhoods, people are more likely to have a smartphone than a computer. So something like this is a tool that will be useful for people who want to change and people who need the information, they just don't know where to find it.
I just want to plant one seed that you should think about. Since a couple of you communication school, the aspect of micro-targeting, you need to think a little bit more about how to drill down in terms of your group connecting to the community so it can be measured in some way. I think it's a great concept. The micro-targeting aspect would be something that you should really talk about that.
Well, we definitely are looking to work very closely with the organizations we've already met with to make it a community embedded project. So we're going to work with community-based organizations through our partnerships to embed it. So it's not, when you think of the FitPhilly app, it's not going to be a city-wide app. It's going to be my community, my corner store, my farmer's market. And we are going to work very, very directly with community organizations to do that.
Great. Unfortunately, that was our last